Hello and welcome to the channel. If this is your first time here, it's a pleasure to have you with us. This space was created to help men and their families better understand prostate health, the available treatments, and the possibilities for recovery, especially after prostate cancer treatment. Today, we're going to talk about something extremely important and concerning for many men. What happens to sexual function after a radical prostatectomy, which is the surgery used to treat prostate cancer? Many men, especially those who are younger, worry not only about curing the cancer, but also about the functional consequences of the surgery. This includes urinary control and, most importantly, sexual performance. These aspects are intimate, sensitive, and have a deep impact on quality of life. Before we talk about recovery options, it's essential to understand the role of the prostate in the male body. Even though it's a vital part of the reproductive system, many men don't know exactly what it does. The prostate is a small gland that's part of the male reproductive system. It's located deep in the pelvis, just below the bladder, and in front of the rectum. Its main function is to produce a fluid that makes up most of the semen. This fluid nourishes and helps transport sperm. Behind the prostate are two small sacs, called seminal vesicles, which store this fluid. But the most important detail, running along the back of the prostate, are extremely delicate nerves, responsible for erection. There's one on each side, and preserving them during surgery is essential for maintaining erectile function. During a radical prostatectomy, the goal is to completely remove the prostate and seminal vesicles to eliminate the cancer. But the challenge is to do this while preserving the surrounding structures as much as possible, especially the erection nerves and the pelvic floor muscles that help control urination. Depending on the stage and location of the cancer, it might be difficult or even impossible to spare those nerves, and that can directly impact sexual function. One of the most common side effects after surgery is erectile dysfunction, meaning the difficulty in getting or maintaining an erection firm enough for sexual intercourse. This can happen even in men who never had problems before. It's worth noting that erectile dysfunction can also occur naturally with age. Risk factors include aging, smoking, diabetes, high blood pressure, high cholesterol, obesity, and certain medications. But in the case of surgery, the issue is often related to the manipulation or removal of the nerves. Another unavoidable consequence of surgery is the end of fluid ejaculation. Since the prostate and seminal vesicles are removed, the body no longer produces that fluid. So, all men will experience what's called a dry orgasm after surgery. Each man reacts differently to this. Some say the sensation is the same, just cleaner. Others report less intensity, and some even say the orgasm feels more powerful. The key is to understand that this change is permanent and varies from person to person. Another possible consequence is penile shortening. This happens because, before surgery, the penis receives regular blood flow, thanks to spontaneous erections, especially during sleep. These nighttime erections help keep penile tissue healthy and elastic. After surgery, these erections often stop temporarily, reducing blood flow and causing the tissue to contract slightly. Some men think part of their penis was removed, but that's not the case. It's a physiological response to the lack of regular oxygenation in the tissue. Another issue, less commonly discussed, is urine leakage during orgasm. This is called climacturia. It happens when a man is still regaining control of the bladder, and during climax, some urine may be released. It's not dangerous and usually improves with time and proper rehabilitation. So, to summarize the main effects after surgery: difficulty with dry orgasms, possible penile shortening, and urine leakage during climax. But here's the good news. There are effective ways to manage all of this. There are three main strategies to help with erectile function recovery. The first is the use of oral medications like sildenafil. These drugs are not just taken to cause an immediate erection, but also to maintain blood flow to the penile tissue, helping prevent damage and supporting long-term recovery. Many men expect that taking a pill will bring back erections right away, but that rarely happens after surgery. The main goal is to preserve tissue health during the healing period. The second option is penile injections. Yes, this can sound intimidating, but they're highly effective. The medication is injected directly into the base of the penis and creates a stronger, more reliable erection. Many men who overcome the psychological barrier report better results and faster recovery. It also promotes proper oxygenation in the tissues, which is essential. The third option is the use of vacuum devices. These create suction that draws blood into the penis, making it firm enough for intercourse. However, this blood is less oxygenated than the blood that comes through pills or injections. Still, it helps preserve tissue health and keep sexual activity possible during recovery. If none of these methods work, there's still one more option: a penile implant. This is a device surgically inserted into the penis that allows the man to control the firmness manually. It's safe, discreet, and highly effective, especially for those who haven't had success with other methods. In addition to all these techniques, pelvic floor physiotherapy is essential. Men who work with specialized physiotherapists before and after surgery usually have significantly better results not only with urinary control, but also in sexual performance. With the right guidance, correct exercises, and commitment, the benefits are real. It's important to remember that recovery takes time. There's no fixed timeline. Some men improve within a few weeks. Others may take months or even more than a year. The most important thing is to be patient, have open communication with your partner, and be willing to explore different rehabilitation strategies. With support, information, and persistence, it is absolutely possible to regain a satisfying sex life after surgery. If this video helped you gain clarity and a better understanding of what to expect after prostate cancer surgery and how to move forward, please give it a like and share it with someone who could benefit from this information. You can also leave your questions, share your story, or comment below. Your experience could help other men going through the same journey. Thank you so much for watching. Take care of yourself and see you in the next video.